Again, depending on the person, you might want to move to the back, the curve of the back. You can do a massage, you can do knuckling, you can do feathering, you can do kissing, you can do sucking again, depending again on what you're trying to elicit in your partner and how they respond. Always be astute, always be aware of the response. Are they moaning or they're cringing? Be aware, okay? You move down the lower back to the buttocks. Ooh, people love to be touched or slapped or kneaded or knuckled. Again, kissed, caressed. You want to, each time you have that sexual encounter, you want to do something different. So try something different next time and ask, do they like it, right? We're going to avoid the genitals right now. We're going to come back to that in a minute. But let's go down to the thighs, the inner thighs, the outer thighs. Again, touching lightly or touching firmly. Kneading, right? Massaging, okay? You go down to the knees, behind the knees. Ooh, that is one of my favorite areas. In front of the knees, nice massage, especially if there's some pain. Again, using some oils. Kisses, lightly kissing or heavily sucking, again up to the partner and up to you. Come down to the calf, lovely area to try also. Again, kneading because it's been a long day at work, right? Massaging, touching, sucking, kissing, down to the feet. Now, I am not a foot person, so if you're a foot person, go for it. Sucking the feet, putting the whole feet in the mouth I've seen, right? Up to you, but be careful. Sucking the toes, again massaging the toes and pulling the toes and just getting the fingers in between with oils, okay? The sole of the feet, the top of the foot, again you want to try different areas, do a foot bath if you want to, and then find out whether your partner likes that, okay? So don't forget, those are the areas that I really like, especially when you're in a relationship with someone that you really are close to, okay? All right, so let's go to the different male and female parts that are very important for you to know. Okay, we know the brain. Men are from Mars, women from Venus. We already know it's different, so get in touch with that difference, and it's okay. Know your partner, learn your partner, go with the flow, as a friend of mine said, so that you can understand how your partner works and how your partner thinks, okay? To me, it's like getting to be a soulmate with your partner, getting to know your partner, and not mimicking, but at least being aware of what he wants or she wants without words being said. That's what I call a soulmate, okay? So let's do the females first. This is my vagina, uterus, cervix, okay? It's something I want you to see because I want people to understand that when you're having sex, they're penetrating into the vagina. Okay, and when they're entering the vagina, they're actually hitting the cervix. And the cervix is something that, if the man can reach it, can give pleasure and it can give pain too. So some people like it to be hit and some people do not like it to be hit. And it's all in not only technique and position, but it's all in how long your vagina is and how long his penis is, or how short your vagina is, or how short his penis is. So remember, it's not really important to get it hit if you're that sort of person that doesn't need it to be hit. Now, I do know some patients that like the cervical orgasm where it has to be hit. But for me, it's all a matter of finding another way to please your partner, your female in this case, when you cannot get to the cervix. And of course, that G-spot we're going to get to in a minute. Okay? So I show you here the ovaries. Okay, and this is the uterus where we carry the baby, and when you are actually having sex, you're going to have that uterus move with the sexual movement and the motion, and then all the contractions are going to go with it too. So I just want you to take a look at that, okay? Next, in the females, we have the to me, most important part, which is, of course, the vagina, or what we call in medical terminology, the vulva. Okay, so we have the mons pubis, which is the top of your pubic area. Then we have the outer lips, which is called the labia majora. Okay, you see those outer lips there with a little bit of hair I put on there. Then the inner lips, okay, which is called the labia minora. We have the opening here called the urethra, the vagina, that's the opening right there, the fourchette, which is where we meet the labia minora and the labia majora, the perineal body, which is the perineal area. Again, these are all areas that need to be touched, and the anus. Okay? The clitoris, of course, you know, is the main arousal organ that we women like to be touched. But you've got to touch it very gently, okay? I'll tell you why. I'm going to show you a cross-section of the clitoris, okay? So the clitoris has this nerve right here, okay? It's called the dorsal nerve. And that is really coming from the pudendal nerve, and it has to be stimulated. Now, there's the main superficial dorsal vein there, and the deep dorsal vein here, and the dorsal artery, and the deep arteries. That's going to give blood flow and engorge the clitoris and make it arouse and make it grow and make it enlarge. So you have to be aware of all this is going to go on depending on how much pressure you put on it, okay? The corpus cavernosum is what is going to fill up and allow it to swell up, okay? So that nerve is very important in terms of how much pressure you put on it. So be aware. You're going to have to learn how to sense and how to feel your partner's response when you're actually touching the clitoris, because these nerves have to be aroused in order for her to get pleasure, even though there is some scientific proof that you don't actually have to arouse the clitoris, because the mind can arouse it, and you can actually have other pathways that can be awakened and have someone have a great orgasm, okay? So be aware, it's a shortcut. There are other ways of getting aroused too, okay? Now, in the glands of the clitoris, now I didn't make this in color because I just wanted you to understand that the size of the clitoris, the shape of the clitoris, the shape of the vulva, the shape of the vagina is, I mean, there are thousands of them. So you just have to get an idea of, just know that there's a little button up there with a little fold that has a hood, and it also has that glands that the man has also, and it has an inner lip, and it has a frenulum, just like the male does, okay? So all those areas in the clitoris. Examine your own clitoris. Guys, examine your partner's clitoris and look at it and see the different parts of the clitoris so that you can understand that depending on how much pressure you put on it, again, whether it's sucking, whether it's touching, whether it's rubbing, whether it's stroking, whether it's massaging, you have to be careful because you can put too much pressure, because there are a lot of folds in there, and you have to know exactly where it is so you know where you're putting your pressure, okay? And of course you want to come out to the outer lips and the inner lips and the vagina, and of course you're going to get all these juices flowing from all the different areas of the vagina, and you'll find that sometimes you can get them to squirt if you can get them aroused enough in terms of producing a lot of fluid, okay? So we have the paraurethral glands here, and we have the Bartholin cysts here and Bartholin glands there. So you want to be able to know that's the general anatomy of the clitoris, because that's where you can actually get someone to squirt if you can find their female prostate, which is the G-spot, which is the urethral sponge. So the urethral sponge is what actually allows women to squirt, okay? So squirting is a technique where when you are aroused, a woman is aroused, all the fluids that come from the paraurethral glands, the paraurethral tubules, and the paraurethral ducts allow this fluid, this spongy-like collection of fluid to come right into the urethra, as if you're going to have a urination or have an episode of peeing, but you're not actually. You're actually just getting a lot of fluid coming out of the urethra and allowing you to squirt that fluid. Now, again, some women have problems squirting, some women don't. It's because these glands sometimes can be closed, can atrophy, and can actually not be used if you're closing down and not allowing yourself to relax and ejaculate. So that's called a female ejaculation. And some women actually have a problem doing that, but some women don't. So if you want to learn how to have a female ejaculation, just know that it is possible. We can talk about that on the next talk, okay?
In the morning, feeling free. Touch my back.